at this point in time, there are, for the first time ever, more people over the age of 65 than under the age of 5. As we see older adults age, this is so important that as they age in good health and free from disabilities. That was already true before the COVID crisis, but the vulnerability of older adults have been further exemplified, and we've seen those dramatic situations in senior living facilities.
There is going to be a doubling of the elderly population. So we're talking about 1.5 billion people by 2050 being in the elderly populations.
I often think it's really only now, because of COVID, that the world's sort of woken up to the value of home and community-based care. The other thing we are seeing is, this shift in healthcare from hospital to home. It was already sort of in a gradual motion. COVID thrust it into high gear.
Family care still remains our main aspect of community care. We have a primary health care system, and we're still multi-generational families, which is challenging in its own way. We knew that our healthcare system could not manage COVID. We at that time only had 42 ventilators in the country.
Your operations people are under a deluge of new information. Do we wear masks? What is the level of PPE? All that has to keep changing, and technology can really help us to offload much of the day-to-day routine, particularly for companies like ourselves who are in the realm of bringing digital technology to mobile and home-based care.
How do we expand the use of technology to monitor, to assess, to expand the socialization for all people? How do we support that family caregiver so that they can be a bigger part of the solution as we provide care to an aging population?
We have absolutely seen with COVID an explosion, as you mentioned, in terms of virtual care in elderly individuals as well as in our general population. And this doesn't mean just for minor aches and pains. It really can be for management of significant chronic diseases, diabetes, hypertension, hypercholesterolemia, heart disease. All of these can be treated highly successfully through virtual solutions. When one can render care virtually, one protects the elderly individual from having to go into a physical setting where they may in fact be exposed to somebody with COVID.
We're really only limited by the number of great caregivers that we can attract. And I think there was a very low awareness for caregiving as a profession. The public over the last decades, or ever since we started, looked at it as a very entry-level menial job. I think this is going to be to home and community-based care advantage going forward, because the world looks at caregivers differently now.
Not all the older people are frail. We are talking about quite heterogeneous population among older 65 years old. Pandemic is going to happen again. And so as climate change, climate-related disaster will happen. So we better be prepared.
Adopting technology and getting used to that new way of working can be tricky. There is an essence whereby the people who need technology the most sometimes are the least likely to use them.
We should not really leave older people behind. We really have to include and listen, empower older people as a part of the solution. We shouldn't decide policy for them, but we should decide policy with them.
In the process of developing and planning our built environment, we can include older people who, generally speaking, have expertise and perspectives and are very committed to the places that they live in. A lot of the measures to counteract COVID do cut across some of the other needs of older people, such as autonomy and independence and social connectedness. Addressed right, the built environment can have a huge impact on on quality of life and health and well-being for older people. And it needs to be considered holistically as part of any initiative.
All our countries are at different stages, but we can all learn from each other. And for us, home and community care is going to have to build on what the culture of each country already has and what they want.
I know we all want to be done with COVID, but we do not want to be done with the lessons we've learned in this last 3 or 4 months. There's so much we can do when we put all that exists today together.